Good afternoon, everyone. My name is Ellen Pliska, and I'm the Director of Family and Child Health at the Association of State and Territorial Health Officials.
Hi, everyone. My name is Diana Kaplasik, and I am the Senior Analyst at the Association of State and Territorial Health Officials, and I focus on tobacco and chronic disease prevention. We would like to welcome you to today's interactive webinar, Exploring Messages on E-Cigarettes Aimed at Women and Youth. In 1964, the U.S. Surgeon General released a milestone report that formally addressed the severe health risks of smoking and tobacco use. In the 50 years since the report's release, the United States has made considerable progress in reducing the tobacco use epidemic. However, public health agencies are now facing new challenges due to the emergence of smokeless tobacco products such as electronic cigarettes or e-cigarettes. Today's webinar, hosted by the Association of State and Territorial Health Officials, or ASTHO, in partnership with the Association of Maternal and Child Health Programs, the National Association of County and City Health Officials, and the Children's Safety Network, we will explore messages that have been developed regarding the poisonous threat that e-cigarette liquids pose to young children and the negative effects that nicotine has on brain development in adolescents. Furthermore, we will explore public health messages aimed at women before and during pregnancy on the use of e-cigarettes. We will introduce each of our speakers before they present on the call today. All phone lines for participants have been muted during this webinar. If you have a question for one of our speakers, please post it on the chat box on your screen at any time during the webinar. These questions will be used during the Q&A after today's presentations. At the conclusion of the webinar, you will be directed to an evaluation survey. Please take a few moments to provide us with feedback on today's webinar. We really look forward to hearing your comments. Also, a recording of this webinar will be posted to the ASTHO website within the next week. The website address will be provided on the last slide today.
Thank you, Diana, for giving us some background information on the webinar. We are joined today by an esteemed panel of experts who will be telling you individually more about their specific role in tobacco control. Before each speaker, we'll be providing a brief introduction, and we will anticipate that there will be many questions for our speakers, so we've made an effort to allot time for that at the conclusion of the panel presentation. Our first speaker today is Desmond Jensen. Desmond Jensen is a graduate of William Mitchell College of Law and is a staff attorney with the Tobacco Control Legal Consortium. He works primarily on shaping federal tobacco control policy by encouraging the Food and Drug Administration to enact strong tobacco control regulations based on its authority under the Family Smoking Prevention and Control Act. Desmond also educates the public health and scientific communities about rulemaking processes and highlights opportunities to engage the FDA to create better regulations. He helps the public health community in its efforts to close regulatory gaps and enact novel regulations that anticipate further regulatory issues. Desmond provides legal, technical assistance to members of the public health community who wish to participate in the regulatory process. He also provides litigation support to defend tobacco control policies that are challenged by the tobacco industry. We are thrilled to have Desmond with us today. Desmond, I'll turn it over to you.
Thanks, Ellen. And thank you again for inviting me to speak on this webinar about a really important topic. I have a lot of ground to cover, so I'll try to move quickly. But if you have any lingering questions that don't get answered today, feel free to contact me at any time in the future. First off, if you aren't familiar with the Tobacco Control Legal Consortium, we are a national network of legal centers providing legal technical assistance to tobacco control professionals and advocates around the country. The consortium's team of legal and policy specialists provides legislative drafting and policy assistance to community leaders and public health organizations. Feel free to contact us at any stage as you develop and implement tobacco control policy. Before we start discussing how to regulate them, it might be useful to talk about what exactly an e-cigarette is. Up until the last couple of years, almost every e-cigarette on the market looked pretty much like an ordinary combustible cigarette. In order to coax smokers to switch, the idea was to mimic a cigarette as much as possible. On the inside, an e-cigarette is nothing like a combustible cigarette. You can see in the diagram below that each device holds a cartridge filled with a nicotine solution that is heated by a heating element powered by a battery. The solution is aerosolized and inhaled into the lungs, much like cigarette smoke. These cig-alike devices come in two varieties: the rechargeable, that allows a user to buy additional nicotine cartridges and recharge the battery, which means the device can be used as long as the electronics continue to work. The other type is the disposable, which comes with a pre-charged battery and pre-filled cartridge. Once the battery dies or the nicotine solution is consumed, the entire device is disposed of. Regulating the disposal of e-cigarettes is a topic for another day. Now, if we were conducting this webinar a few years ago, there wouldn't be much else to say about these devices. But over the last few years, the market for e-cigarettes has changed dramatically, and the version of the product that is growing the fastest in popularity looks nothing like a combustible cigarette. These are often referred to as tank systems or tank mods. These devices are customizable in almost every way, from the size of the tank that holds the liquid nicotine, the temperature of the heating element, to the voltage of the battery. They range in appearance from the most ordinary in the top left to the most opulent next to it. That device was purchased by a Russian oligarch for his girlfriend, and it's covered in 500 carats of diamonds. Even on the cheap, these devices are customized to fit anyone's hobbies, adults and children it seems, including Nintendo, Hello Kitty, Game of Thrones, and even Star Wars. Now, because these devices are not disposable, they have to be refilled, which requires a user to buy liquid nicotine. Nicotine dissolved in propylene glycol and vegetable glycerin can now be purchased in almost every city and town across the country. It is often sold in fruit, candy, dessert, and alcohol flavors. The solutions vary in nicotine concentration, from those that are alleged to contain no nicotine at all to the gallon jug that you see at the bottom that can be purchased by anyone over the internet, which is concentrated to 100 milligrams per milliliter. And because I'm sure you're wondering, that jug contains enough poisonous nicotine to kill over 300 adults weighing about 200 pounds. Yours for just $350. It's also worth noting that many of the mom and pop shops out there that sell this stuff will mix your preferred concentration and flavor on site. The picture here of a woman wearing gloves while she mixes is definitely not the rule, which is another huge health hazard, as nicotine can be absorbed readily through the skin. One last category that I want to mention is the vape pen, sometimes called the e-hookah. This is a much more fluid category. Although most of the products are disposable, some aren't. They're almost always sold in youth-attractive flavors, and the devices are usually very small. Many youth are entering the e-cigarette market with these devices because they are easy to conceal so that they can be hidden from teachers and parents. Because they are rarely labeled as e-cigarettes, kids often don't know that they contain harmful and addictive chemicals. There's also a growing overlap between these types of devices and marijuana vaporizers. In the center, you see a picture of a vaporizer endorsed by the rapper Snoop Dogg. Moving on to the whys and hows of regulation, particularly when it comes to maternal and child health, all of the looming unknowns as to the public health effects of these products should be an indicator that the precautionary principle should guide us as we think about how to regulate them. It's often the case that we have to remind the public that a lack of a scientific finding that a product is harmful is not the same as a finding that a product is safe. And in the past, even drugs that have been approved by the FDA for use by pregnant women have had tragic consequences down the road. We really still know very little about the long-term health effects of these products, and unfortunately that will remain the case until people have been using them for many years. What we do know about nicotine is that it is highly addictive and that it can be devastating on the developing brain. A good summary of the information about the effects of nicotine can be found in Chapter 5 of the 2014 Surgeon General's report. There's also a very real risk that these products can be a gateway to other tobacco products. Kids are experimenting with them at alarming rates. And while there are hundreds of anecdotal stories of people using e-cigarettes to quit smoking, we don't yet know the population level effect on cessation. And it's also important to remember that the manufacturing of these products is completely unregulated. No one is ensuring that there's consistency in the production of liquid nicotine or that the devices meet any sort of quality control standards whatsoever. So who is regulating e-cigarettes and how are they protecting maternal and child health? Currently not the FDA. You've probably heard a lot about the FDA's future regulation of e-cigarettes and the so-called deeming regulation that will bring the products under the FDA's authority. Currently, the FDA only regulates a few types of products, and e-cigarettes are not one of them. After the FDA finalizes and implements its deeming regulation, it would begin regulating e-cigarettes and other currently unregulated tobacco products. What will FDA regulation look like? In addition to a variety of information reporting and more global authority over the products, the FDA's rule would establish a minimum age, prohibit vending machine sales except in adult-only facilities, prohibit sampling, and establish warning labels. If you haven't seen it already, it's worth looking at the proposed warning label for e-cigarettes. Obviously, these are the current warning labels for cigarettes and smokeless tobacco, and they're fairly short and direct. Smoking can kill you. Smokeless tobacco is addictive. This is the proposed warning label for e-cigarettes. Warning, this product contains nicotine derived from tobacco. Nicotine is an addictive chemical. It's incredibly benign and could barely be considered a warning. There are also a number of restrictions that apply to cigarettes and smokeless tobacco that the FDA did not propose to extend to e-cigarettes, like prohibiting self-service displays, establishing minimum package sizes, prohibiting flavors, prohibiting brand name sponsorships, and requiring notice for advertising. While there are a number of things that the FDA proposed to do to regulate e-cigarettes, there are many others that they have not proposed to do. And I also want folks to understand that the FDA has only just begun a very long process with a lot of red tape. It is almost certain that the tobacco industry will challenge some aspect of the agency's final rule, and that ensuing litigation would delay FDA action even further. We are years away from FDA regulation of e-cigarettes. So the message for state and local governments is, do not wait for the FDA. If you want to regulate e-cigarettes to protect maternal and child health in your community, do it now, do not wait. Now, what can state and local governments do to regulate e-cigarettes? Here's a list of FDA do's and don'ts, and with very few exceptions, state and local governments have the authority to do what the FDA proposed to do and the things that the FDA left on the table. It's a long list of policies, all of which would have a positive impact on public health. I want to focus on just two that are particularly important for maternal and child health: flavored product sales restrictions and mandating child-resistant packaging. Starting with child-resistant packaging, I'm sure that you all heard about the tragic poisoning death of a toddler in upstate New York just last month. I've been describing the potential for poisoning from liquid nicotine as a public health time bomb, and unfortunately it seems as though the clock may be running out. This death was entirely preventable, and if no action is taken, it will likely not be the last. As I said earlier, the nicotine content of these refill containers varies widely from nothing or next to nothing to incredibly high. Many retailers classify a 12 to 18 milligrams per milliliter dose as medium, and most packages come in quantities of 10 to 15 milliliters, which means that the majority of the refill containers have more than 100 milligrams of nicotine in each bottle. This is estimated to be enough to kill a toddler. In addition to being fatal, these chemicals have packaging with bright colors and often have pictures of fruit or candy. It's no wonder that calls to poison control centers reporting liquid nicotine ingestion have skyrocketed from just a couple hundred in 2011 to almost 4,000 in 2014. So what do we do now? I'm sure that everyone on this webinar has encountered this. Almost every over-the-counter drug comes in a bottle that requires you to either line up the cap in the bottle or push down on the lid while turning. Both of these methods are simple for adults to open but very difficult for children. These types of bottles are already widely available for liquid nicotine, and some companies are beginning to utilize them voluntarily. They actually look virtually identical to bottles that are not child resistant, which is why it is not enough to rely on voluntary action. Many state and local governments are not waiting for the FDA. Minnesota, Vermont, Illinois, and Davis County, Utah have all implemented laws requiring child-resistant packaging for liquid nicotine. There's also a growing list of communities that are considering something similar, and this list is probably already outdated. We fully expect to see more of these laws passed during the current legislative session, and this will likely continue to build momentum for this policy. Now, while the policy in general is an obvious one, how it gets implemented can be tricky. Which products are covered and how exactly a jurisdiction determines whether a package is child resistant can be much more complicated. And jurisdictions have gone in different directions on these questions, and none of them have been challenged in court yet. If you're considering implementing a child resistant packaging policy, we would encourage you to contact the consortium to discuss your options. Lastly, I want to discuss flavored tobacco products. I'm sure I don't need to convince all of you that flavored tobacco products are much more attractive to youth and are often viewed by youth as being less harmful than non-flavored products. They represent a clear danger to young people, and the ubiquity of flavors in the e-cigarette market in particular is leading many jurisdictions to seriously consider prohibiting the sale of all flavored tobacco products. New York City, Providence, Rhode Island, and Chicago have all passed laws that restrict the sale of flavored tobacco products. New York and Providence allow the products to only be sold in specific types of tobacco bars, while Chicago prohibits the sale of flavored products, including menthol-flavored cigarettes, within 500 feet of schools. Providence and Chicago's laws do cover e-cigarettes, while New York's does not. Each city was sued. New York City and Providence successfully defended their laws, while Chicago's litigation is still pending, but looking positive so far. This policy is also likely to increase in popularity, as the FDA has not proposed to limit flavors, and many communities are tired of the industry targeting youth with flavored products. Unfortunately, there isn't time to talk about some of the other policies that would also have a large public health impact, such as including e-cigarettes into clean indoor air laws or taxing them at the same rates as other tobacco products. But the thing to remember is that there are a variety of options available to communities that want to take action. And just to remind you one more time, if you are considering a policy, you can contact us to receive free legal technical assistance. We can help you at any stage as you develop and implement your policy. Our website also has lots of resources on not just tobacco control, but healthy food, active living policies, as well as other public health topics. Thank you for your attention, and I look forward to any questions that you might have.
Thank you so much, Desmond, for all of your comments today. We appreciate you sharing such a great overview on e-cigarettes and examples of regulations to improve maternal and child health. I would now like to introduce our next speakers, Laura Olivan and Parker Smith. Laura Olivan serves as the Tobacco Control Manager for the Minnesota Department of Health. She has been with the agency for 4 months and brings with her over a decade of successful health promotion and tobacco prevention and control experience in Rhode Island and Minnesota, working at the state and local level. Parker Smith serves as the Tobacco Communications Coordinator for the Minnesota Department of Health. He's been with the department for over a year and a half and leads communications planning and strategy for the agency's tobacco work. He holds an MPH from the University of Minnesota. We are thrilled to have Laura and Parker with us today. Laura and Parker, I will now turn it over to you.
Thank you. Let me just advance the slide. We are pleased to present to you today and share our experience in working on e-cigarette policy and communication at the Minnesota Department of Health. In the next 25 minutes, we will give you a brief background on the Minnesota tobacco control and prevention landscape, so you have a context for this presentation. Share the major findings from our 2014 Minnesota Youth Tobacco Survey. Talk about the communication goals and key messaging we developed to accompany our youth e-cigarette use findings from the survey, and describe the rollout and response of our messaging. As mentioned, Parker Smith, who leads our tobacco control communication, will help tell our story. So let's start with a quick background on the tobacco control landscape in our state. Since 2007, the Minnesota Clean Indoor Air Act has restricted smoking in nearly all indoor public places. However, until 2014, this did not include e-cigarette use. Showing prescience, in 2010, the legislature passed the Tobacco Modernization Law, which prohibited the sale of nicotine delivery products to minors. And in that respect, Minnesota was ahead of their time. In 2013, new tobacco tax laws significantly increased excise tax rates on cigarettes and other tobacco products. The legislature increased the cigarette tax by $1.60 to a total of $2.83 per pack, the tax on other tobacco products to 95% of wholesale price, and the tax increase also covered nicotine cartridges of e-cigarettes, one-time use e-cigarettes, and e-juice containing nicotine. In 2014, the law changes were introduced related to e-cigarettes. E-cigarettes are now prohibited in Minnesota in some schools, hospitals, government buildings, and universities. There were further prohibitions on sales to minors, and it requires stores selling e-cigarette delivery devices to have a tobacco license. It also required behind-the-counter sales of e-cigarette products, with the exception of adult tobacco product shops. And as I'll describe more in a minute, it required child-resistant packaging, which, by the way, just went into effect on January 1st, 2015. So these changes did stop short of prohibiting e-cigarette use in all indoor places. One other word on Minnesota. We're lucky to have the statewide Health Improvement Program, which funds 38 local public health authorities to work on obesity and tobacco prevention, as well as 9 tobacco-free community grantees and 9 tribal grantees. We also work closely with the Blue Cross Blue Shield Center for Prevention and Clearway, Minnesota grantees. So as a result, we have a comprehensive tobacco control network to help disseminate the messaging we will talk about today. And we recognize how fortunate we are to have that infrastructure. Part of the impetus for some of the 2014 law changes on e-cigarettes was the release of 2013 data on the spike of e-cigarette poisonings in Minnesota. We work closely with our Minnesota Poison Control System to analyze tobacco-related poison reports. In 2013, they reported 74 e-cigarette poisonings overall, with 50 reports involving kids and teens. This was a 10-fold increase from 2012. Keep in mind that e-cigarette poisonings were virtually unheard of prior to 2013. Several of those calls involved toddlers and infants less than 2 years of age who swallowed the e-juice. Some calls involved teenagers who had been using e-cigarettes. One other aspect I wanted to highlight from the 2014 law is Minnesota's new child-resistant packaging requirement, which recently went into effect. We are one of only 3 states, 3 plus another that Desmond just highlighted, so it's been updated, to have such a law in effect. It requires our retailers to have child-resistant packaging on the sale of liquids used for electronic delivery devices. The way the law is structured, enforcement of this requirement is on our city and county licensing authorities. I want to give a plug for the Public Health Law Center, who has recently posted on their website a legislative spotlight piece highlighting the key provisions of this law if you'd like to know more about it. Now that you have the Minnesota context, we can talk about the results of the 2014 Minnesota Youth Tobacco Survey. The MYTS, as we call it, is one of the most important public health monitoring tools that we have. We conduct it every 3 years, and it collects in-depth data on youth tobacco use. The 2014 survey included many questions about new products, especially electronic cigarettes, as well as conventional tobacco products. Public schools and classrooms across the state were selected at random and invited to participate. Overall, we have 4,243 students in grades 6 through 12 that took the survey. The survey is recent and went into the field in early 2014. Well, what did we find? We are very pleased to report that the rate of cigarette use among high school students during the past 30 days dropped from 18.1% in 2011 to 10.6% in 2014. That was the largest decline in the history of the survey. So success has many mothers. There's strong evidence base that price increases are the most effective strategy to reduce tobacco use. We believe the cigarette tax had a major impact on youth tobacco use, as well as our clean indoor air laws that I've just described. We have also built an impressive community community capacity through our grant programs to empower disparately impacted populations to advance policy systems and environmental change and promote health equity. The percent of students who use any conventional products, including cigarettes, cigars, chew, and the like, also dropped from 25.8 to 19.3%. The survey, however, was not all good news. For the first time, the survey asked about e-cigarette use. They found that a whopping 28% of high school students reported ever having tried an e-cigarette. The survey also found that 12.9% of high school students used or tried an electronic cigarette in the past 30 days. One note that unlike conventional cigarette use data and reporting, e-cigarette 30-day use may reflect experimental or occasional use. We're also seeing that tobacco companies are taking advantage of the lack of e-cigarette marketing regulations as an opportunity to market to youth. Tobacco companies are using old and well-tested marketing techniques to introduce children to nicotine and the new product. The survey found that more than half of high school students, 57%, saw an e-cigarette ad on TV in the past 30 days. About half, 48%, saw one in a convenience store. One of the other concerning findings is the level of youth menthol use at 44.3%. In 2014, we changed the wording for the youth menthol use question, which may explain the slight drop. Overall, however, the number remains high. Of note is the contrast between the high percentage of youth smoking menthol and the adult menthol use rate at 25%. Like the flavorings in e-cigarettes and other tobacco products, menthol masks the harsh taste of tobacco, making it even more attractive to youth. One other note worth mentioning to this audience with the focus on maternal child health from the MYTS is also reflected in what our grantees are observing all over the state, is the changing landscape of tobacco use. As cigarettes have become more expensive and less attractive to youth, they are experimenting with novel and often flavored tobacco products that are dangerous and continue to expose them to nicotine. So as we prepare to roll out the YTS data, we developed 4 strategic goals for our communication plan. We wanted to inform stakeholders of the new findings and the data. We wanted to alert parents and community members about youth e-cigarette use. We wanted to educate the public on the health risks of nicotine and reinforce the importance of clean indoor air and other proven tobacco control strategies. Those goals guided all of the activities that I'll now describe. So our messaging celebrated our state's success in reducing youth tobacco use, underscoring the effectiveness of tobacco control policies like price increases and comprehensive clean indoor air. In describing the data and findings, we noted that many of the youth using e-cigarettes were also using conventional tobacco products, so dual use. Additionally, we were concerned to find that 1/4 of youth who tried e-cigarettes had never used a conventional tobacco product. For them, e-cigarettes may be a dangerous introduction to nicotine. Because of the advent of youth e-cigarette, because the advent of youth e-cigarette use is relatively new and the body of research is still developing, we spent a great deal of time thinking about how to characterize the health risks of youth e-cigarette use. I'd like to say that we are certainly aware of the emerging body of research related to particulates in the aerosol and the danger of inhaling flavorings. So after reviewing the body of research, which is constantly evolving, and upon consulting with the CDC, we decided to firmly base our messaging on the findings in the 2014 Surgeon General's report. With this as our guide, we concluded that where the science and the research is the most definitive is on the health risks of nicotine to youth. So we made nicotine the centerpiece of our health risk messaging. We focused our messaging around the 4 concepts listed in this slide. We emphasized repeatedly in the rollout of this data that e-cigarette use puts our youth at risk, that no amount of nicotine is safe for youth, and that nicotine is addictive and harmful to the adolescent brain development. We further emphasized that e-cigarettes are not regulated by the FDA, and that e-cigarette use may be especially harmful if it leads to ongoing use of nicotine and other tobacco products. The YTS also asked new questions about exposure to e-cigarette advertising. We emphasized that cigarette advertising hasn't been allowed on TV, radio, or billboards for decades. E-cigarettes may be harmful if they glamorize or renormalize tobacco use, including exposing children to images of tobacco use. Finally, we used the decline in youth cigarette use to emphasize the effectiveness of proven tobacco control strategies like price, youth access, and compliance. We especially highlighted the importance and effectiveness of clean indoor air policies, which served as a key opportunity to highlight the critical importance of prohibiting public indoor e-cigarette use. Now I'd like to introduce Parker Smith, who will highlight our communication and dissemination strategy for the messaging we developed.
Thanks, Laura. As part of our communication strategy, we compiled our new nicotine-focused messaging to create a comprehensive toolkit that would enable our grantees and partners to talk about the new data as well as the health risks of e-cigarettes. So what we packaged together ended up being our set of talking points and new messages, a summary of significant data points from our new report on youth data to help provide an at-a-glance set of data that is organized by topic. We also included an infographic to visually summarize some of these main points and our key messages, which could then easily be shared on social media. I'll show you that in a minute. We included our e-cigarette fact sheet for some background information, as well as the executive summary from our new youth report, which highlighted some of the significant findings in more detail. And lastly, we included a question and answer document to prepare our local spokespeople for questions about the data. And one example in particular, a question we anticipated and did happen to get was, isn't it a good thing that more kids are using e-cigarettes instead of conventional cigarettes? And using the messaging we developed, our answer would be that this new data indicates most of, or more than 60% of youth who use e-cigarettes are also using conventional tobacco. So regardless, no amount of nicotine is safe for youth, and kids should not be exposed to nicotine in any form. And here's the infographic I promised. We included this with the toolkit, and it was developed in collaboration with our state partners, and as you can see, incorporates our main messages. For a closer look, you can find this on our website. So just before the broad release of our new youth data, we invited our tobacco control partners to a heads-up call. On the call, we briefly discussed the new findings and provided an overview of our key messaging. But at the same time, we distributed our toolkit to these partners and also our local grantees. Then, just hours after our heads-up call, the new data was released broadly during our scheduled press conference. And at this conference, we featured Dr. Ellinger, Minnesota's Commissioner of Health, as well as our lead epidemiologist who worked on the Minnesota Youth Tobacco Survey, as well as a youth representative from the Minneapolis Youth Congress. And despite enduring one of our typical Minnesota snowstorms, Nearly all of our local news networks, including the Associated Press and Minnesota Public Radio, were in attendance. Afterward, we held a Q&A with our panel and offered the media a chance to ask the youth about their experiences with e-cigarette use in school. And as we anticipated, our release gained extensive media coverage. Since November, our story received almost 22.5 million views or impressions through media coverage, which also includes many outlets from out of state. And in addition to the headlines, many of these news stories did indeed pick up on our messaging on the dangers of nicotine, as well as the health risk to youth. In the end, though, the release of our data served as an important platform for our agency and our network of tobacco control partners to inform the public on the health risks of e-cigarette use. And that message continues to spread even today. And that's all we have now. Thank you for your time, and we look forward to answering your questions later on. Also, you're welcome to contact either of us directly after the webinar with questions about any of our messaging.
Thank you so much, Laura and Parker, for your comments today. We really appreciate both of you sharing all the great work that you're doing in Minnesota. We know that there will be a lot of questions about your work and want to remind today's participants that you can submit questions for our speakers at any time into the chat box on the screen. We have provided time for our speakers to answer these questions at the conclusion of the presentation portion of today's session. We will also be sending out all of the slides to the participants within the week. So look forward to those. I want to welcome our next speaker, Dr. Jonathan Klein. Dr. Klein is a pediatrician and a health services researcher and is the founding director of the American Academy of Pediatrics Julius B. Richmond Center of Excellence, which is dedicated to the elimination of children's exposure to tobacco and secondhand smoke. He was on the faculty at the University of Rochester in New York for 18 years in adolescent medicine and as an associate chair for community and government affairs in the Department of Pediatrics. Dr. Klein joined the Academy as Associate Executive Director in 2009, where his oversight responsibilities include research, tobacco control, publishing, and international health. We're pleased to have Dr. Klein with us today. Dr. Klein, I'll turn it over to you.
Thank you, Ellen, and thank you, Diana, and thanks to ASTHO for sponsoring today's event. I'm going to spend a couple of minutes talking about e-cigarettes and the electronic nicotine delivery systems from a clinical perspective and from some of the work that we've been engaged with at the Academy. I think you've all heard the background so far that these are products that are designed and are appealing to adolescents and young adults. And actually every one of the things in that crayon box are e-cigarette products. None of those are actually crayons or markers. And so they really are mimicking things that are going to be very difficult to detect in many settings for young people. And as we heard in the first presentation, the flavorings, bubblegum, fruit-flavored things are designed to be palatable and attractive to youth. Obviously, this is a big concern for us as pediatricians for several reasons. And the marketing, as we've heard, there are very few restrictions on the advertising or no restrictions on the advertising. And you can see the advertisements are using themes of sexuality and imagery that is, again, designed to appeal to different youth audiences. That ad on the right there is from the same Sports Illustrated issue that had the swimsuit models on the cover. And so again, the marketing designed to promote the products as being associated with youth and sexuality in the same way that the tobacco industry did for many, many years for traditional combustible cigarettes. We've heard new data from Minnesota on both the great impact they had from their campaign, but also the rise of the e-cigarette data. And I think what we see from data from CDC and from other surveys, as well as from state tobacco surveillance, is that every time you look, the prevalence of these products continues to rise. And we've gone from less than 1% in most places only 3 or 4 years ago to 5 and 6, and now up into the mid-20s, 28% in the Minnesota data for high school age students. And that's for the students who actually recognize that the products they're using are e-cigarettes or e-hookahs or vape pens. Again, the confusion over what to call them and what is use continues to be an underreport when it comes to much surveillance. And so we have increasing numbers of users. We have young people responding to the advertising. Among adults, the numbers also continue to rise with again, low numbers in 2011 and 12 and an increasing proportion. And again, the most concerning thing, as our colleagues in Minnesota reported, 25% of the youth users were never smokers when it came to traditional combustible tobacco products. We find the same kind of proportion among adult users of e-cigarettes as well, where significant numbers of e-cigarette users are never smokers. The other group of e-cigarette users that's concerning is that, again, a substantial number are what we've defined at the Academy's Richmond Center as distant former smokers. They have not smoked a traditional cigarette product in more than 5 years, and yet they report recent electronic cigarette use. And I think that number becomes equally important because of the industry's use of the claim that, oh, well, smokers are using these to try to quit or to use a less harmful product, even though the evidence base for cessation with e-cigarettes is minimal to non-existent. The fact that many of the e-cigarette users are these distant former smokers, people who long ago quit but are becoming re-addicted to nicotine, directly refutes that. And some of the publications from our center, led by Robert McMillan at the University of Mississippi Social Research Center, have some of the data there in recent publications. We've got some of those citations on our website as well. So what are the health effects of these products? Relative to combustible tobacco, there is less tar and less of the particulates that are present in combustible tobacco. There are, however, measurable and variable levels of nicotine. Whether these, in fact, provide a step down in dosage similar to cessation methods is an unproven claim that the manufacturers make. It may be less harmful than smoking tobacco products, but compared to not smoking at all or using medical grade prescription or over-the-counter replacement therapy with nicotine, there clearly is an increased amount of harm from these products. And our belief is that if people are going to be responsible in addressing tobacco control, the responsible position is to say that one has to first regulate the advertising and the promotion to youth before one talks about whether there might be a positive benefit to harm reduction or cessation, and that the evidence that it's a benefit would need to be demonstrated just like any other therapeutic use might need to be demonstrated. The evidence is emerging mainly from animal models right now that exposure to e-cigarette vapor, and in fact secondhand exposure to e-cigarette vapor, actually causes a decrease in lung function and slower lung growth and slower lung development in mostly in mouse models. Sharon McGrath-Morrow at Johns Hopkins, another one of our center's investigators, has been studying this in a model that already existed for prenatal and newborn mice that was a secondhand tobacco smoke exposure model. They've exposed these newborn mice and the prenatal exposure of these mice to secondhand e-cigarette vapor. And not only does it address and harm their lung function and growth, in fact, the vapor without nicotine in it also harms developing lungs because of the propylene glycol when it's heated and what effect that has on lung growth. And infant mice exposed prenatally and during their first 2 weeks of life, and again, we can do this experiment in mice, actually have measurable effects on their behavior as adults. Now, mice become adults a lot more quickly than our children do, but if we have evidence emerging from animal models that the harm of nicotine exposure is just as measurable as it is from traditional combustible tobacco products, it would seem that the prudent course of action would be to protect our children from them and not to allow the products to remain unregulated. Again, there's a quality control issue in the e-cigarette products because of the way the solution is mixed and the fact that adulterated products are in the market and are not in any way controlled or safe. Again, it results in new nicotine addiction, and we've talked about the toxicity of nicotine. The safety of the flavorings and of some of the other agents that affect the way it feels when you use it when they're heated and inhaled is unknown, but some of the flavorings actually have proven toxicity, and there's evidence that's emerged that some of the flavors create the same kind of lung damage that the hot oil from popcorn machines can create. And so it's known as a popcorn lung effect, but you can get that from some of the e-cigarette flavors as well. And again, this may impact the smokers who have tried to quit in terms of their overall trajectory. The public health effects, again, secondhand e-cigarette vapor is not just harmless water vapor. It emits measurable and variable levels of nicotine. They're less than that of combustible cigarettes, but you actually can identify measurable absorption of nicotine from secondhand exposure to the e-cigarette vapor, just as you can measure that in people exposed to traditional cigarettes. The particulates also can be harmful. And again, the toxins, we're seeing increasing evidence. Some of you may have seen California's public health declaration yesterday that the e-cigarette vapor also contains formaldehyde and some of the other toxic chemicals that are present in traditional cigarette smoke as well. And the fact that this is beginning to renormalize imagery of smoking, that people are using them in places where smoking is not allowed, that we're seeing them in TV and other video and billboard settings again for the first time since the early 1970s, and that they pretty much look like cigarettes in many of the imagery in the media is a significant concern when it comes to addicting young people to tobacco in this generation. We've heard a little bit about the liquid itself. This is a list of some of the things that can be in the liquid. All of these are not in all of them, but as some of you know, the refillable products can be refilled with liquid or wax products that are used for marijuana rather than for nicotine as well. And it's indistinguishable in its use from the nicotine products. What the long-term health impact of the various products are and their inhalation really remains to be seen, but again, acting prudently would seem to make some sense there. This is just a graph of the poison control calls. We've talked and heard a little bit about the safety packaging and the number of calls and the number of children potentially harmed, as well as the number who will wind up harmed, like the deaths that occurred in New Jersey, remains to be seen. The Academy was a vigorous sponsor at the federal level of the Child Nicotine Poisoning Prevention Act of 2014 that Senator Nelson and Representative Esty had sponsored. This was a very narrow bill designed to allow the Consumer Product Safety Commission to regulate the packaging of e-cigarette liquid. Because it's a tobacco product, it is exempt from CPSC rules. The bill died at the end of the session. There was a hold on it from the current majority side in the Senate, but there was pretty good bipartisan support for moving this forward, and we're hoping that this will move in the current session as well. From a clinical practice perspective, pediatricians and other clinicians need to be sure we're asking the right questions about tobacco use and about secondhand smoke, and these need to include asking about e-cigarette and other electronic nicotine delivery devices, as well as exposure to secondhand vapor from these devices. We know that we have a long way to go in getting all of the adult clinicians who care for adults with chronic illness or getting any of the folks caring for kids to really be asking these questions very consistently. But recognizing that this is an opportunity to enhance the referral to quit lines, to enhance the cessation messaging in clinical practice with parents and other adults who are highly motivated to protect their children from harm. And so the route of referral to quit line through pediatric sources of care is an important component of state tobacco control programs, and it's one that we've asked our state chapters to be active in advocating for, as well as to do their part in addressing the clinical education of healthcare providers. Until we know more about any of the e-products and cessation evidence, we really need to be recommending only approved NRT and quit lines and other evidence-based interventions for smokers who want to stop smoking or to stop their nicotine addiction. And electronic cigarettes should not be used in any setting in which there are non-smokers, pregnant women, or children who need to be protected from their exposure. The easiest way to do this is to include them in all traditional cigarette clean indoor and outdoor air control regulations, but this requires action at state and local levels throughout the country. The other policy implications, the FDA ought to move a little more quickly with their deeming in order to actually establish the authority over the products. We understand why they're moving slowly, but the pace is really somewhat depressing when we realize how quickly this epidemic has contributed to the tobacco epidemic for our society. We do need research about the effect of secondhand vapor, as well as the addiction potential and the dual use issues. But again, the research needs to err on the side of protection of our young people, not on the side of a free and unrestricted market until we have demonstrated the harm. Child-proof packaging is obviously a critical component of safety for children, and again, including all of these devices in all smoke-free air laws and purchase and sale laws is an important set of actions. The Academy has a variety of resources, both to help our members, but also to help in the public health arena with these issues. The Julius B. Richmond Center of Excellence at the Academy is a center dedicated to the elimination of tobacco and secondhand smoke from children's lives. Our main sources of support come from the Flight Attendant Medical Research Institute and from the Legacy Foundation, but also from other grants and donations. We have a set of resource materials for clinicians, for parents. Some of them deal with emerging products. There are about 30 different PowerPoint sets that can be pulled down and used from the Richmond Center website. And there are a bunch of webinar series, including a few on e-cigarettes that summarize some of this evidence in a bit more detail. Again, that can be used as enduring resources. And we have a set of resources that are designed specifically for states that address some of the state policy issues that we've worked on with our state chapters and with our community health advocates. The center also has a network of tobacco control champions around the country who've been part of mobilizing the voices of pediatric clinicians to help provide a pediatric perspective on why it's important to protect children from tobacco. And if you're working on these issues in your states or in your communities, we're very happy to help connect you with local experts who can be spokespeople about the importance of child health issues. So let me stop there. I'm looking forward to the questions. The pictures, by the way, that bookended my presentation are children's artwork about clean air and secondhand smoke. There's a library of sort of the top 40 of them from an art contest that we've sponsored over a couple of years that are available for use in other settings. That's also on our website if people would like to use them. And if you have any questions, please feel free to email us again, on the website are links in to do that. Thanks again.
Thank you, Dr. Klein, for such useful information on e-cigarettes and sharing the clinical perspective on this topic. We would now like to share some resources available from ASTHO, NACCHO, AMCHP, and the Children's Safety Resource Network related to e-cigarettes. ASTHO has several resources on our website that may be helpful to states. The first is a booklet highlighting recommendations about smoking cessation strategies for women before, during, and after pregnancy. This publication includes examples of the work that several states are currently doing in these areas of tobacco control and prevention, and it was a collaboration through our tobacco and MCH projects at ASTHO. We've also written comment letters on proposed tobacco control regulations, including issues like menthol and e-cigarettes. In addition, you will find on our website a collection of our webinar recordings, state resources about e-cigarettes, including our recently released issue brief on e-cigarettes, and a spreadsheet of resources that have been compiled and organized by ASTHO. The web address for ASTHO's tobacco website, where you can access more information about all of these resources, is up on the screen now, and it will also be provided on the last slide of the presentation along with our contact information. ASTHO's Maternal and Child Health Project hosts the Healthy Babies Clearinghouse, a website of state case studies and emerging, promising, and best practices around improving birth and maternal outcomes. The Clearinghouse houses state stories, tools, and other resources by time of impact: preconception, interconception, prenatal, birth to 28 days, and the first year of life, and by socio-ecological model: policy, organizational, data, community, provider, and self-management. It also features a section on specific state strategies to improve birth outcomes, including smoking cessation. ASTHO also collaborates with NCSL, the National Conference for State Legislatures, and we wanted to share their website as it also contains valuable information for state and local health agencies. NACCHO, the National Association of County and City Health Officials, also has a section on their website dedicated to e-cigarettes. There, you will find their policy statement on e-cigarettes. AMCHP, the Association of Maternal and Child Health Programs, offers a place on their website that features the AMCHP Innovation Station. This is a place where AMCHP encourages states to submit examples of innovative work in the area of e-cigs and maternal and child health. The Children's Safety Resource Network hosted a webinar on e-cigarette poisoning last month. The recording and slides are available on their website. They also did a blog post about e-cigarette poisoning last year, which is also available on their site. Just as a reminder, the slides for this webinar will be posted to the ASTHO website along with the recording within a few days. And within the next day, all participants will also receive an email with a copy of these slides for your reference.
At this time, we will begin the question and answer session. If you'd like to ask a question, please type it into the chat box located on your screen. We've received many questions already, so I'll start with those as we wait for more to come in. The first is just a comment. This comes from someone who works as in the poison control calls. As a veterinarian, this person is seeing increased number of calls and emergency room presentations of dog and cat poisonings that also mimics those seen in children. And so they just wanted to see if anyone had any comments about that, that could be to any of the speakers.
Diana, I don't know anything specific about cats and dogs, but we're about to undertake an analysis of the poisoning reports for this last year to see who is being poisoned, how many, and the nature of the poison reports. So we'll expect to tabulate that data and produce potentially a report around that, or at least release the findings, so stay tuned. Glad to know about it.
Thank you. Okay, we received another question. This one is requesting a general response about the best way to go about policy implementation. They're wondering if it is recommended to address e-cigarettes by community, district, or at the state level, and where's the best place to get started? That would be for anyone.
If no one wants to start, I can. I would strongly recommend to start at the state level. Then you don't have to worry about the local level. However, that's not always easy to do. So sometimes if you begin at the local level and you can build momentum that way to the point where you can attain enough support and mobilize enough communities and stakeholders to get state level policy change.
This is John. I really think it also depends on where you got the political will to move it forward. I think we've got the evidence base in hand, and we have the strategies that can be implemented. And it really requires having the support of your elected officials as well as your health department focus on taking some action. I think that again, all of the organizations and the websites that we're talking about have resources to think about, what are the strategies you can take. Certainly we have policy tools online, as do most of the others, that can talk about the specifics of what to put in regulation or legislation. But I think what we learned with the communities putting prevention to work, and with some of the programs that have succeeded them that CDC has actively supported, there also needs to be that political will in the local or state community. So looking at the public health and advocacy community and assessing sort of what's the feasible step has got to be part of the equation, and working towards the goal of protecting people from products.
This is Desmond. I would echo what everyone else has said, and then just add, like others have said, if you have an ambitious state legislature and you can do something at the state level, that's great. If you don't, but you have a local coalition that's strong, and doing that is also good. At the local level, county or city, you also need to look at, if you're intending to do policy work, you have to make sure that your jurisdiction has the authority to do what you're hoping to do, and also that you're not preempted by state law. So if you're doing something at the local level, there are a couple of other little things to iron out, but that doesn't mean that you can't get something done.
We do have a follow-up question that's along the same lines. Someone is looking for any advice for local jurisdictions or states that may be up against exclusions for vape shops in Indoor Clean Air Acts, allowing for sampling in stores. Are there any states or counties or even cities that have had this exclusion, and what are you seeing?
This is Desmond again. I was just waiting to see if anyone else was weighing in. But when you're looking at your clean indoor air law, that can be tricky and complicated and difficult, depending on what you want to do. And if you're intending to go back and revisit any exemptions, if you already have prohibited the use of e-cigarettes in various places, and you want to go back and target vape shops and sampling and that sort of thing, is always a great thing to do. But you always want to be careful that in opening up that law, you don't accidentally undo something you didn't want to do. We see in a lot of communities, the tobacco industry and e-cigarette companies have lobbyists, and they will send experts in and try to undo things if they can. So it's always important to be very careful. If you haven't yet prohibited the use of e-cigarettes, if you haven't included them into your clean indoor air laws, thinking about doing it and working ahead of time to ensure that you can message that properly and make sure that you can properly state the problem and why you want to solve it is going to be really important, because when there are people who want to target that law and create exemptions, vape shops and cigar bars and things like that are a pretty common target. So if you want to be very comprehensive, make sure that you have your resources in order long before you start putting pen to paper.
Thank you so much. We've received another question, and could any of you comment on how or whether communities or states can restrict youth-targeted marketing and advertising of electronic nicotine delivery devices or electronic nicotine delivery services, and how they could go about doing that?
Desmond, I think you're probably the best one to answer.
I was afraid so. Advertising is very difficult. I am not a naysayer by any means, but when you are targeting advertising in particular, you have to be very, 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 very cautious, because the First Amendment is a very powerful tool for the tobacco industry to challenge tobacco control policy, and we've seen that at all levels of government. So you have to be careful to craft a policy that will withstand litigation, because anytime you are attempting to restrict advertising, the likelihood of litigation is very, very high. So if you are targeting things like outdoor advertising or point of sale, limiting the policy to areas near schools, or using the local authority on zoning and licensing to limit the places and the time, place, and manner of advertising, is going to be easier to overcome a litigation challenge, but certainly not guaranteed. I would say that if you have local will to do something to limit e-cigarette advertising, you may have a better bet going after a thing like a sales restriction, like limiting flavors, or limiting sales near schools. And in so limiting those products, the retailers won't be able to advertise them because they can't offer them for sale. So it's sort of, you do get advertising through another avenue, but it's, as I said in my presentation, New York City and Providence were able to limit flavored products, and that held up in court. So it is easier to overcome litigation than if you were purely regulating advertising.
Thank you. Our next question is coming from a little more of a personal place. This person has a daughter whose friends are using e-cigarettes and wants to know how they can be better educated, since these students believe that e-cigarettes are just vaping water and don't think that there's anything else in them. And so she's looking for a way to educate teenagers on the facts of e-cigarettes at a family level, or if there are any family or community resources out there that may be beneficial for families.
This is John. I think that if you look at some of our educational material for families and teens, or some of the other groups, the evidence for the addictive nature of the products, especially for young people who are non-smokers and who are not addicted to nicotine, are really quite clear, and the harm of nicotine is quite clear. And so I think, like with any other adolescent behavior, that parents need to set expectations, explain why their expectations are based in the concern for their teen, and work with their clinicians to try to help guide teens towards safe and healthy behaviors. You can provide the same kind of information to your teenage kids or to younger children. And I think the other thing, again, that's been strongly evidenced with regard to tobacco advertising is that the media imagery that's shown is false when it comes to the impact of the products on health and on lifestyle. And I think Legacy's Truth campaign has made that case elegantly with combustible cigarettes. Much of the same messaging is true around e-cigarette products. Rather than try to deliver the message entirely by parent communication, perhaps looking at some of that content together may in fact help get that message through in the family setting. But I think, again, for parents to remember that their ability to influence their teens' behavior through setting expectations and addressing health issues is quite strong. Even if it apparently is not received, it actually is well received when it comes to teens' behavioral choices.
Thank you for your response to that. We do have a question around what kinds of behavioral differences were noted in some of the mice studies that were where the mice were exposed in infancy. Dr. Klein, I believe that's for you.
Yes, I'm sorry. What about the exposures there?
Absolutely. What are some of the kinds of behavioral differences that were noticed in the mice exposed in infancy? Did that were you able to see any longer term from the offspring of the mice and any differences there?
So the study, which is currently in press and should be out in the next couple of weeks, actually, from the folks at Hopkins, what they have is they had mouse that were exposed, mice exposed during the pregnancies of the mice. And the exposure was sort of the equivalent of about 10 minutes of e-vapor secondhand exposure a day. And then the same mice, once they had been born, were continued, their exposure continued for about 2 weeks while the pups were still breastfeeding and with their moms. They then took some of the mice once they had grown to adulthood, and I'm sorry, I don't remember how many months it is for a mouse to become an adult, but it's not all that many. And they put the mice through some standard behavioral tests that look at some of the impulsivity and some of the correlates of hyperactivity and behavior disruption that are measurable in mice. And again, I'm not expert in this area, but the mice who had been exposed to nicotine through the e-cigarette vapor demonstrated behavioral changes and consistent differences from mice that had not been exposed. The human data in the Surgeon General's report from, I believe it's from the 2012 Surgeon General's report, but the Surgeon General's report on the effect of smoke and secondhand smoke on children has shown us pretty clearly that there are behavioral correlates to traditional cigarette exposure, secondhand exposure in early school-age children. There are more disruptive behaviors, more behavioral problems in early education, and more hyperactivity symptoms in children with tobacco exposure. And so it's interesting and concerning that some of the animal model data is suggesting that some of the same kinds of effects in the same direction are there with e-cigarette nicotine exposure as well.
Thank you, Dr. Klein. Our next question is, how would you respond to somebody that says, should we embrace e-cigarettes which support replacing traditional cigarettes or combustible cigarettes for adults? We've been talking a lot about kids, so how would you respond to those questions? And that could be for anybody.
Well, this is John again. I think I addressed it a little bit in my original comments that it's possible that as a harm reduction these might have a use, but until we have first completely addressed marketing to young people and the addiction of non-smokers or the re-addiction of smokers who have quit, to say that because they might have a benefit is an irresponsible position from a public health point of view. If we believe that they might have a benefit, then let's put them in controlled settings and study that question of benefit rather than call for them to be unregulated in the marketplace and allow them to be flavored and marketed in a way that we know is likely to addict young people who are non-smokers.
Our next go ahead, please.
Sorry, I just want to add one thing. That was beautifully said, John. I would also add, we always say that e-cigarettes are unregulated, and that's entirely true. But if any of the e-cigarette manufacturers chose to, they could apply to the FDA Center for Drug Evaluation and Research as a cessation product and try to get their products approved for cessation purposes. And none of them have done that yet. From the manufacturer's standpoint, it's pretty clear that they're out to make a buck. They're not out to protect public health. So that's also an important thing to keep in mind.
Thank you. So our next question kind of goes along the line with some of the discussions around online purchases for e-cigarettes and other associated products. Since there's many that have no age verification and it's just a checkbox that says they're 18 or older, and paying by debit card is hard to verify. So what can be done legally about these online sales in individual states or beyond?
I'll weigh in, and anybody else is free to weigh in as well. At the state and local level, I won't say there's no way to do it. It would certainly be challenging. At the federal level, obviously the ability to regulate interstate commerce and how products are moved throughout the country and sold over the internet is much simpler, and it's well within the FDA's authority to do anything from completely prohibit the sale of e-cigarettes online or to create an actual age verification system that would work. The FDA did propose in their deeming regulation to require minimum age of purchase, and that would include online sales. So it remains to be seen exactly how that will be implemented and enforced. Hopefully that would at least get at part of the problem. The FDA has been very aggressive at their retail enforcement, so hopefully they would treat internet sales the same way. At the state level, I don't recall which state, and I want to say California, and if anyone's from California and I'm wrong, I apologize, but I think that California had proposed to address this problem at the state level and to either prohibit or limit internet sales by the shipment of the product into the state. And I don't recall if they were prohibiting the product from coming in once it has been purchased over the internet, or if they were requiring age verification at the point of delivery. But those would both certainly be options for a state to undertake. How that gets enforced and implemented is probably going to be challenging, and I would assume costly. So it would have to be a state who is really ambitious and wants to take that on. At the local level, city or county, that difficulty is multiplied, I'm sure, by lack of resources and potentially lack of authority. So it's probably difficult to do at the local level, but it is something that a state could certainly look into, and there are regulatory options at the state level.
Desmond, this is John. Is there any opportunity or any route that the attorneys general could take to address the online sale within the context of state enforcement of age of sale restriction?
Yeah, that's a good point as well. I was just thinking of that after I finished speaking. Yeah, certainly there are on the books in almost every state some form of a consumer protection law, and if there's enough evidence that it's very easy for youth to purchase e-cigarettes within a state and receive them without any real age verification, it would be within, most likely in most states, it would be within the Attorney General's authority to enforce laws that are already on the books, and at the very least, you know, some sort of civil action against whoever is shipping the product to the state. There could be problems if the product is being shipped from overseas, and I don't know how many of the websites, you know, operate overseas. I'm sure there are some. I know that most of the product is manufactured overseas, and then over the internet, I'm not sure. But that certainly also is an avenue that states could consider. And if it's a problem you want to address at the local level, you know, writing a letter to your Attorney General and gathering evidence about the problem would certainly be something you could do at the local level to put pressure on the state to act.
Our next question is around what are some of the consequences or outcomes of women who are pregnant or breastfeeding or have recently delivered and using e-cigarettes. We've talked a lot about youth and some adults, and so we talked about mice studies. What are we starting to see, or what are some of the things you're hearing around pregnant or recently pregnant populations?
I'm not aware of any data about e-cigarettes and pregnancy. I think it's a good question, but I don't know that anyone's actually done that surveillance, and it doesn't sound like it'd be terribly ethical to study.
Thank you. Our next question is a few states and a city have recently launched media campaigns addressing e-cigarette harms, including vapor pollutants, poisoning risks, and addiction. In your opinion, what are some of those top priorities for messaging that states or communities could emphasize in thinking about future campaigns?
This is Parker. In Minnesota, we found it important to keep our messaging focused on youth and the harms of nicotine. We know that nicotine is harmful for youth and adolescent brain development. And additionally, when it comes to tobacco prevention, we know which strategies are proven, such as increasing the price of tobacco as well as restricting indoor use.
And our final question, and we'll certainly do our best to see if we can answer some of those that have come through that we haven't been able to get to, but can anyone comment on e-cigarettes or e-juice on the global market? I know we've been focusing this webinar particularly internally to the United States and its jurisdictions, but they're wondering if we're the only country where usage of e-cigarettes and related products is up. If that's anything you've looked at.
From our experience in the pediatric and adolescent area, this is a global problem. The industry has been marketing these heavily in all countries where tobacco products are already in use, and that's pretty much a global phenomenon.
Thank you. Diana, I'm going to turn it back to you.
Thank you so much, Ellen. We want to take the opportunity to thank all of you for joining us today. As we mentioned earlier, you will be immediately directed to an evaluation at the conclusion of today's webinar. Please take a few minutes to complete our survey, as it really does provide us with useful information for our future products. ASTHO would like to thank the CDC Office on Smoking and Health and the Health Resources and Services Administration, Maternal and Child Health Bureau Office of Policy and Coordination for co-sponsoring this webinar. We would like to thank NACCHO, AMCHP, and the Children's Safety Resource Network for helping to plan and promote this webinar. We would also like to thank NCSL for their input on today's webinar. Most of all, we would like to thank our speakers, Desmond Jensen from the Tobacco Control Legal Consortium, Laura Olivan and Parker Smith from the Minnesota Department of Health, and Dr. Klein for the American Academy of Pediatrics. A recording of today's webinar will be available on our website within the next few days at the web address on your screen now. We hope that you will use this webinar as a resource, and we'll share the link with others once it is available. If you have any follow-up questions about today's webinar, please don't hesitate to contact either myself, Diana Katzlasik, or Ellen Pliska at ASTHO. Thank you, and enjoy the rest of your day.
Thank you. Ladies and gentlemen, this does conclude today's conference call. You may now disconnect your lines. Presenters, please hold.